Men and women of Merck Pharmaceuticals, I am General Benjamin Carter from the Biomedical Advanced Research and Development Authority. I hope your helicopter rides here were uneventful. We are meeting here in Hopewell, New Jersey, because it is equidistant from Merck's Research and Development Center in Union County, New Jersey, and Merck's Technical Operations Facilities in Pennsylvania. This site was selected because of its access to rail freight. You will soon understand the importance of that. You are about to embark upon perhaps the greatest mission of your professional lives, a mission to save humanity from an enemy that has already infiltrated our daily existence. This enemy does not come by air, land, or sea, but rather by algorithm, screen, and notification. We call this digital pathogen the Sapien TechnoVirus. You know its symptoms well. In stage 1, constant distraction. We initially dismissed it as a byproduct of modern life. In stage 2, obsession. Work, relationships, even basic self-preservation begin to erode. Rage scrolling and doom loops consume the victim's mind. Internet brain rot sets in. They begin to wander aimlessly. These lost souls will soon clog our roads and streets, which is why access to railways is so critical. In stage 3, the afflicted are transformed into grotesque, zombified shells of human beings, decomposition, social collapse, the phone zombie apocalypse. I will now yield the floor to Dr. Evelyn Hull to brief you on the virus.
Make no mistake, this is an emergency. The virus, known as Sapien TechnoVirus, alters neural pathways, diminishing independent thought and amplifying digital dependency. What makes it particularly insidious is that it initially mimics normal behavior. By the time physical symptoms appear, the infected have already lost their ability to make rational decisions. We estimate 60% of the global population is in stage 1 or 2. Stage 3 cases are rising exponentially. But there is hope. Our research team at the Lehigh Valley Institute of Science and Technology, with funding from BARDA, has developed a dual-action countermeasure. Mice were immunized with a viral antigen, stimulating their immune systems to generate specific antibodies. B cells isolated from the spleens of immunized mice were fused with myeloma cells, forming hybridomas, immortalized cell lines capable of continuously producing high-affinity antibodies. Screening and selection yielded hybridomas producing high-affinity antibodies, which were selected and cultured. This structure was modified to make them more human-like through genetic engineering. In the laboratory, our monoclonal antibody has successfully bound to specific receptors of the Sapien TechnoVirus, exposing the pathogen and enabling the host's immune system to neutralize it. However, our mAb must be rapidly optimized and tested to ensure both safety and efficacy, as the survival of the human race depends on it. Now, as I stated before, we believe we hold the keys to dual-action countermeasures, a prophylactic dose for those at risk and a curative dose for those already infected. That being said, the path to deployment is fraught with challenges. Our mAb is fragile and has many sensitivities. It is sensitive to light, which will degrade and discolor the clear liquid solution. Heat will have the same effect. Shock and vibration will cause the long-strand proteins to bind together. If this occurs in the field, the therapeutic will be rendered ineffective. This is why you are here. Each of you represents a crucial piece of this mission. We will need cross-functional collaboration to take this from concept to reality. We have a long road ahead of us, and time is our enemy. Let's now get to work.
We're dealing with 3 populations: healthy patients, mildly afflicted, who can still follow instructions, and the severely afflicted, who may have the cognitive function of a goldfish. This means our injection device must be foolproof. Red means curative, blue means prophylactic. Additionally, a tactile ridge differentiates the curative setting for those unable to see clearly. My job is to ensure that our auto-injector works for real people, infected or not. Human factors engineering means designing for clarity, ease of use, and worst-case scenarios.
Labeling is not just about compliance, it's about saving lives. Patients in advanced stages will struggle with text-based instructions, so thanks to the leadership of Margaret Song, we've adopted large, high-contrast icons, color coding, and multilingual support. The font will need to be 40% larger than standard pharmaceutical labels for quick recognition. Now, let's discuss manufacturing at scale.
This is where things get tricky. We need to scale production across two modes. Ultra-low volume, semi-automated for initial testing, clinical trials, and smaller markets. High-speed production, capable of short production runs for targeted outbreaks while maintaining the ability for mass production for global distribution. We must optimize capacity and utilization through queuing theory to ensure production efficiency and responsiveness. Now, this brings us to supply chain logistics.
We don't just need to make these, we need to get them to the right people before they hit stage 3. The supply chain is a minefield. Cold chain logistics. The drug must be stored at 2 to 8 degrees Celsius, with allowable excursions up to 40 degrees Celsius for a 5-hour window. Disaster zones. Some regions may be in total infrastructure collapse by the time we deploy. Last mile delivery. We're exploring drones, self-contained refrigeration, and even mobile dispensaries. But none of this matters if the injector itself fails.
While all of this happens at breakneck speed, we simply cannot ignore sustainability. We must not compromise our secondary packaging solutions' ability to protect against accidental activation and maintain thermal stability, but we at Maersk must also be good environmental stewards. This means keeping the footprint as small as possible to achieve maximum pallet density, limiting our materials to a single recyclable waste stream, exploring the use of paperboard with a percentage of recycled content, biodegradable polymers, and minimalist protective housing to reduce environmental impact.
Given the formulation's viscosity and the selected needle bore size, we have identified a single commercially available auto-injector capable of meeting the required break-loose and glide forces. While we are fortunate to have a stock offering available, this device has one critical weakness. The injector has a temperamental needle activation collar. A direct drop onto the activation collar could trigger accidental activation. We cannot redesign the device at this stage. So the burden now shifts to Ken Silverman, our lead protective packaging engineer.